Hello and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician and today I will be discussing vitamins for seniors, what you need and what you don't. There's a lot of information on TV, the internet, and in magazines about vitamins, and it can be confusing. The truth is actually pretty simple, as I hope to show you. I won't be talking about calcium and dietary supplements today. Those will be discussed in a separate presentation titled Calcium and Dietary Supplements for Seniors. The information in this presentation is supported by high-quality medical research and expert medical opinion, and references are given at the bottom of many screens. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. Where is this? This is my local Costco store, and it has 4 rows of vitamins and supplements that stretch off into the distance. Vitamins are indeed popular. The U.S. revenues are expected to reach over $4 billion in 2023, and the U.S. market is expected to grow annually by over 4% a year between 2023 and 2028. And global revenue is expected to reach $48 billion in 2023 for vitamins. Vitamins are natural nutrients. They're required in very small quantities, but they play major roles in human health, and they are essential for life. Vitamins are usually nutrients, but some vitamins are therapies for specific diseases, like AREDS 2 vitamin combination for age-related macular degeneration. Today we're going to be talking about nutrient vitamins, not therapeutic vitamins. These are the 13 essential vitamins. You'll probably recognize most of these, but I'll give you a little hint. There are only 2 of these that you should take as additional vitamins. We get different vitamins from different sources. Some vitamins our bodies make, like vitamin E. Some vitamins, like vitamin K, are made by our intestinal bacteria. We get vitamin D naturally from sunlight. And some vitamins we need to get from food. And in fact, food is the best way to get our vitamins. But sometimes we need to take extra vitamins. Generally, a good diet will provide our daily requirement of vitamins and minerals, but sometimes diet is not enough, either because we aren't exposed to the vitamin sources or we can't absorb the vitamin well. So the big question is, which additional vitamins should we seniors take? The first one is vitamin D. It is an essential vitamin. It's needed for functioning of many parts of our body, including absorbing calcium and building bones, the functioning of nerves and muscles, and heart, blood vessels, and control of blood pressure. It's also important for the functioning of our immune system. Symptoms of vitamin D deficiency include our bones becoming thin, brittle, or misshapen, and also developing muscle pain and weakness. We get vitamin D from sunlight, egg yolks, trout, and saltwater fish, as well as liver. And some foods like milk are fortified with additional vitamin D. But as we get older, we tend to get less sunlight exposure, so we may become vitamin D deficient. Vitamin D, especially extra doses of vitamin D, probably does not prevent or benefit cancer, heart disease, depression, multiple sclerosis, type 2 diabetes, obesity, or falls. Special word about vitamin D in bones. Extra vitamin D, contrary to popular belief, definitely does not prevent fractures in people who are not vitamin D deficient. It's not clear, though, if vitamin D benefits people with osteoporosis, who already have calcium-depleted weak bones, or who have other risk factors for fractures. Dosage of vitamin D, and I'm talking about vitamin D3, which is the recommended type. For less than age 70, 60 international units or 15 micrograms per day. But over age 70, we need a little more, 800 international units per day or 20 micrograms per day. And if you're vitamin D deficient, based on a blood test that your health provider has taken, you may need significantly higher doses of vitamin D to build it back up again. That's vitamin D. The second vitamin that you need is vitamin B12. And indeed, it's another essential vitamin. It's needed for functioning of most cells in the body, especially for red cell production, and also for the functioning of nerves. We get vitamin D from a number of sources: poultry, eggs, fish and clams, meat, especially beef liver, milk and milk products, but it's also frequently added to breakfast cereals and some other processed foods. But here's an important point. We don't get vitamin B12 from plants. So that people who are vegetarians or vegans should be aware of this and know that they'll need to take additional vitamin B12. The symptoms of vitamin B12 deficiency are anemia, especially a kind of anemia called pernicious anemia, but also fatigue, muscle weakness, intestinal problems, numbness and or tingling, depression, and confusion and memory problems. Extra vitamin D probably does not prevent or benefit heart or blood vessel diseases or stroke, probably does not prevent or benefit dementia or improve physical performance. For us seniors, vitamin B12 has some special considerations. Because over age 50, we may not be able to absorb vitamin B12 from food. So we tend to need oral vitamin B12 or fortified foods. And the dosage of vitamin B12 is 2.4 micrograms per day orally. But you can only find much higher doses usually in the drugstore. For instance, 500 or more micrograms per day. But that's okay because any extra vitamin B12 that you take in that you don't absorb will pass through your body and be eliminated. For people with vitamin B12 deficiency, higher doses may be necessary, either orally or by nasal spray or by injection. Vitamin D3 and vitamin B12 are the only additional vitamins that you need. Research shows that high doses of beta-carotene, vitamin A, vitamin C, vitamin E, and selenium do not prevent any diseases or decrease mortality. This is quite different from what you'll hear on the internet, for instance. Furthermore, high doses of beta-carotene, vitamin E, and possibly vitamin A appear to increase mortality from all causes. And we know that high doses of vitamin A and vitamin E are associated with increased risks of both lung and prostate cancer. I'm frequently asked about multivitamins. And multivitamins are widely advertised. Multivitamins do contain vitamins D3 and B12, which are the vitamins you need. But multivitamins also contain many vitamins and minerals that you do not need. And research has even shown that older women who took multivitamins had an increased risk of death. I don't recommend multivitamins. And even the U.S. Preventive Services Task Force, which is a government agency that evaluates medical procedures and techniques and medications, says the current evidence is insufficient to assess the balance of benefits and harms of the use of multivitamins for the prevention of cardiovascular disease or cancer. Basically, multivitamins give you expensive urine. And it's much better to take only the vitamins you need, vitamin D3 and vitamin B12. But what about all these extra vitamins that you might have laying around that you really don't need to take? It's okay to dispose of them by flushing them down the toilet or putting them in the trash, because vitamins come out in your urine anyway, and they're also naturally found in the environment already in foods. For prescription medications, though, you should place them in collection containers that are available at some pharmacies. Sir William Osler founded Johns Hopkins Hospital and Johns Hopkins Medical School and is considered the father of modern medicine. He said, "One of the first duties of the physician is to educate the masses, not to take medicine." Well, I hope today I've educated you not to take most vitamins, but to definitely take two, vitamin D3 and vitamin B12. And I want to finish by saying, I wish you to be healthy. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.